at the connection between faith and health, and mental and social health, and then present a model explaining how faith influences mental health, and then look at effects on physical health, and then present a model describing the mechanisms by which it may affect physical health, and then look at briefly applications to clinical practice, and then provide some further resources. So it's a lot of material, and then I'm hoping that we'll have time at the end for dialogue. So I'm going to go fairly quickly just to ensure that we have time at the end. Okay, so a little introduction to myself. There was a beautiful introduction that Peter gave, but I'm a clinician. I see patients and their families and struggle with them in the clinical area. I've been a researcher for about 40 years now. I was raised a devout Catholic, grew up, born and raised in a devout Catholic home. And I have some special ties to Saskatchewan. Those ties involve my father, who was born in Leader, Saskatchewan.
Oh.
So anyway, it makes this presentation really special. He was born on September 11th, 1919 in Leader, Saskatchewan. Okay, so let's look at how do people cope with loss, change, stress, and health problems. People cope in a wide variety of ways. Many get support from family and friends. Many deal with stress through various ways of distraction, distracting themselves away from it through watching TV, movies, social media, hobbies, travel, playing games, watching sports, cooking shows, staying busy with work, family, and recreational activities. So that's the way many people deal with stress, by distracting themselves away from it. There is also the suppression of feelings directly through alcohol, drugs, overeating, and other various addictions. There's physical activity and exercise, which is healthy, at least up to a certain point, but it also can become obsessive and be a way to distract oneself away from the problems rather than directly dealing with those problems. And then finally, there's religious involvement through prayer, scripture reading, attending religious services, volunteering for religious reasons. So this is a way of coping with stress as well. And in many respects, changing the attitude of a person so that they can deal with the stress better. So, as I said, many people turn to religion for comfort, particularly during times of high stress, loss, change, problems with health, threats to health. Religion often used to cope with challenges such as uncertainty, fear, discouragement, and loss of control. So, when you're not in control of something, you've tried everything that you can, many people then turn to religion because there's nowhere else to go. And in these situations where we're not in control, that often promotes the turning to religion. But if you think about it, we really do control very, very little of what happens to us. Just think about your heart. Are you controlling the beating of your heart? It's just going on, beating along, and when it stops, that's it. That's the end of your life. You have no control over your heart whatsoever. Perhaps by eating right and doing various things, exercising, etc., but really those are pretty indirect. We don't control many of our physiological functions or what happens to us from day to day. And realizing that often causes people to search for something that, that can help them deal with that sense of that they're just not in control. And through faith, that is one way. Now, does faith actually help? What is the scientific evidence that it is helpful? For many, many years, for most of the last, the 20th century and the first part of the 21st, religious belief, at least within the mental health field, was considered something neurotic. Freud had said that it was an obsessional neurosis, and that the less religious you were, the healthier you would be. And in fact, psychoanalysis, and many of his followers who taught psychoanalysis, the idea was to replace religion with a more rational way of thinking and dealing with problems. So that was the way religion was considered when I was trained in psychiatry. It was not something positive. If anything, it was something negative that was primitive and was unhealthy. And I just wondered myself, is that true? Having been raised in a devout Catholic home, I heard many times from the priest, and I was an altar boy, and I did all of the things. I was one of those people who reads at the pulpit the scriptures, and I thought, wow, this seems to be a positive experience, but what I'm hearing is it's negative. So why couldn't we, as I was a medical doctor, and I learned about medicine through science, through what research had found. So why couldn't you just study this? Why couldn't you just objectively measure a person's faith, their practices, and then look at their mental health, which you could also measure and quantify, and see whether or not they were correlated? Was there any relationship between the two? And was religious practice, did that predict better or worse health over time in the future? We could study that. Why couldn't we study that? But I was discouraged. I was told you can't measure religion. But I thought, well, I'm just gonna give it a shot. And I was the first person who had tried this either. There were many others prior to my getting involved. Okay, let's look at faith and mental health. Depression. So this is based on a systematic review of the literature that was published in the second edition of the Handbook of Religion and Health, published by Oxford University Press in 2012. And by the way, literally in January, the third edition of the Handbook of Religion and Health was published, that updates all of this research up through, currently. But what I'm going to present here is based on the systematic review in the second edition. So there were 444 quantitative studies that looked at this connection between religion and depression. They measured religious involvement and measured depression through symptom scales, and they found 2/3 found, surprisingly, that those who were more religious tended to be less depressed and were more likely to recover from depression. And furthermore, religious interventions actually significantly reduced depression with fairly large effect sizes. And of those studies, 6% found more depression among the more religious. And at lower levels of depression, many people, as I said earlier, when they get discouraged, may turn to faith as a way to relieve their distress. And that might be what we're seeing with the more depression in those studies. Now, this is a more recent study. This is out of the Harvard School of Public Health. This was a study of 10,000 young people throughout the United States. They were followed for up to 6 years. And what they found that frequency of attendance at religious services at baseline predicted about a 30% reduction in risk of developing a depressive disorder over that up to 6-year follow-up. So about a little more than a 30% reduction in risk of developing depressive disorder among these young people, average age 23. And this finding is actually after taking into account controlling for more than 24 other predictors of depression, including health problems, prior depression. All of that was controlled for, and independent of all of those other predictors, it was religious involvement that reduced risk by about 30%. Now, what about suicide? That, of course, is the most feared consequence of depression. And quite consistently, of the 141 quantitative studies, about 75% found that religious people are less likely to have suicidal thoughts, make suicide attempts, or commit suicide. Here's more recent research. This is a sample of over 20,000. It's a random sample of over 20,000 Americans. This is part of a very famous study, the NHANES 3 study. And a lot of what we know about heart disease, diabetes, hypertension, stroke come actually from this particular study. And they've been following these 20,000 adults for nearly 20 years now. But one of the questions they asked at the start of the study was, how often do you attend religious services? And among those who said at the start of the study that they attended 2 times a month or more, the risk of actually completing suicide was 94% lower. That was highly statistically significant and certainly clinically significant as well. Now, this is 90,000 women. These are all nurses, actually. This is part of the Nurses' Health Study. This is, again, out of the Harvard School of Public Health. These women, these nurses, were followed for 14 years, and they looked at their risk of completing suicide during that 14-year follow-up. And what they found was that those who attended religious services at least weekly were 7 times less likely to commit suicide compared to those who never attended. Now, bear in mind that this study was published in probably the world's top psychiatry journal. It used to be called the Archives of General Psychiatry, very biologically based psychiatry journal, and later it became JAMA Psychiatry, Journal of the American Medical Association Psychiatry. And so this was a very important study. Harvard School of Public Health, best journal in psychiatry, and ought to have some influence. Now, again, not long after that, again, the group at Harvard published another study, this time looking at deaths of despair. Deaths of despair. These are deaths from alcohol, drugs, and suicide. So these are the kinds of conditions that, addictions and depression are despair, and deaths from despair, very common. And this was a 16-year follow-up study of 66,000 nurses. Once again, you see a 70% reduction in risk of dying from a death of despair among women, among nurses, attending religious services at least once a week or more. And what you have here is what's called a P for trend. What that suggests is that there is actually a dose-effect response, which means the greater the dose of the religious attendance, the greater the reduction in risk of dying from a death of despair. And that's important because it is, in statistical terms, suggestive of a causal relationship. In other words, that the religious attendance is actually causing a lower likelihood of dying from a death of despair. Again, published in JAMA Psychiatry. And here is a study of men. These are the 43,000 men. These are all healthcare professionals. And once again, you see a nearly 50% reduction in risk of dying from a death of despair among those, again, attending religious services once a week or more. And again, you see this P for trend in the data. Now let's move on to the more positive side of mental health, and that is well-being, happiness, life satisfaction. And in fact, the relationships here are even stronger than for the negative aspects of mental health. So of the 326 quantitative studies that were published prior to 2010, 80% found that those who are more religious experience significantly more higher well-being, happiness, and life satisfaction. And of those 326 studies, less than 1% found lower levels of happiness or well-being among those who are more religious. So basically, there are 80 times more quantitative studies showing that religious involvement is related to greater well-being and happiness compared to those showing lower levels of happiness. And again, every one of these studies are documented in the Handbook of Religion and Health. In fact, they're each described, all of them. All 326 are described in the appendix of the handbook. Not only is happiness and well-being higher, but meaning and purpose, hope and optimism are also more plentiful among those who are more religious. So 90 to 100% of studies show greater meaning and purpose in life, greater hope in 73%, greater optimism in more than 80%. And of course, if you think about it, those patients who have meaning and purpose in life, who are more hopeful, who are more optimistic, they're going to do better in terms of recovery, whether they have a mental illness or a physical illness. They'll have motivation to get better compared to the person who is discouraged, depressed, has kind of given up. They're not going to do so well. They're not going to have the energy to do the hard work of rehabilitation to get better after a stroke or after surgery or after even a mental health stay. Let's look at health behaviors. We looked at mental health. Let's look at some of these negative behaviors. Alcohol use, abuse, and dependence. 80 to 90% of these quantitative studies show that religious people are just less likely to use alcohol, abuse it, or become dependent on it. And most of these studies are among young people, high school students, college students, young adults. The same for illicit drug use. 80 to 90% of these quantitative studies published in peer-reviewed academic journals find that religious people are less likely to use and abuse drugs. Also, religious people in general are more likely to involve themselves in healthier behaviors. They're more likely to exercise. In the majority of studies, 2/3. They're less likely to have extramarital sex, which lowers their risk of sexually transmitted diseases. And you know, it was just today on the news that cases of syphilis are beginning to dramatically increase, at least in the United States, over the last few years. Part of that has to do with looser, morals, to say it bluntly, and other sexually transmitted diseases are also increasing because of these behaviors. Now, among religious people, there is one aspect of health behavior that needs some work, and that has to do with weight. So many religious people weigh too much, way too much. And if you look at the studies here, at least 39% show those who are more religious weigh more than those who are less religious, and only a small number show that they weigh less. So let's work on that part. Cigarette smoking, overwhelmingly, religious people are just less likely to smoke cigarettes. And this is coming, here out of North Carolina, which is the second largest producer of tobacco in the United States. And our studies here in North Carolina show that those who are more religious are less likely to smoke. And that's going to have some consequences, right, on the physical health. Are people who smoke have higher heart disease, hypertension, heart attacks. They're more likely to have strokes. They're more likely to have chronic lung disease. And I believe about 40% of all cancers, not just lung cancer, but all cancers are related to cigarette smoking. So if you're not smoking, you ought to have better health. Let's look at social health quickly here. Religious people just have more friends. They have more friends. They have more social support. 80 to 90% of the research that's been published. Not only that, but religious youth are more likely to do better in school. In our systematic review, we identified 11 studies looking at religious involvement of young people and their likelihood of doing better in school. And 100%, all of them, all 11 studies based on this systematic review showed that religious youth have higher grade point averages. They're more likely to graduate from high school and go to college. And consequently, that's going to affect, their ability to produce and their job capacity, as they get into the workplace. Okay. Families are also stronger if they are religious families. Greater marital stability, less divorce, greater satisfaction in marriage, less spousal abuse, more likely to have two parents in the home. And again, 80 to 90% of these studies. Here's a study, a 14-year study. This is the Nurses' Health Study again, and again out of the Harvard School of Public Health, showing that there's about a 40 to 50% reduction in risk of divorce or separation among these nurses over this 14-year follow-up period where they were tracked over time. So here's kind of a model that helps to explain how religion affects mental and social health. It's really, this is out of the 3rd edition of the handbook. Like I said, it's just published in January. And religious involvement is related across the lifespan to better mental and social health, beginning literally within the womb and probably before conception, and depending on the religious involvement of future parents, and then across the lifespan through teenage years, middle adulthood, and especially in later life when things really get rough. Now, of course, genetic factors influence this relationship, and also environment also influences this relationship between religion and mental health and the interaction between genes and environment. Now, there are physical health consequences of these benefits of religion to mental and social health. There's a book called The Body Keeps the Score. The Body Keeps the Score. Like the score in a game. And this was written by a world-renowned physician and researcher, Bessel van der Kolk, I believe he was from the Netherlands. And he's done a lot of research looking at the effects of psychological and social factors on physical health. And so he's written this book, and he talks about how a person's beliefs and attitudes influence their physical body across the lifespan, beginning in young adulthood, in fact, in the teenage years. Now let's look at faith and physical health, immune function and risk of infection. So the majority of studies, of the 25 studies that have directly looked at this, again, quantitative studies, measured religious involvement, measured different aspects of immune functioning. More than half show that religious involvement is related to better immune functioning. We actually did one of the first studies showing this, showing that actually religious attendance was related to lower levels of pro-inflammatory cytokines, which is basically what we're talking about here is that, you know, the more frequent you go to church, the stronger your immune system is, and the more likely it can fight off infection, it can fight off cancer, it can speed recovery in terms of wound healing. And this was one of the first studies published more than 20 years ago. And that study was actually replicated by an entirely different research group that wasn't connected with Duke at all. This was at the University of Iowa. These are psychoneuroimmunologists, and they measured religious attendance, and they looked at the pro-inflammatory cytokines like we did, and they looked at mortality as well. And they were able to show that, you know, those who are attending religious services at least once a week had better immune function, and consequently that better immune function explained the greater longevity among those attending religious services more often. Now here is a study looking at gingivitis. Gingivitis, you know, the infection around your teeth, in your gums. And this is of 42,000 healthcare professionals, including dentists. And what they found was there was a more than 25% reduction in risk of developing periodontal disease in this study. This was a 4-year prospective study. These dentists and other health professionals were followed for 4 years, and those who were participating in religious meetings or services had better gum functioning, less gum disease. This is a study of 382 HIV positive patients who were followed for 1 year. And they're looking here, they're measuring the concentration of the AIDS virus in the blood, the concentration of the AIDS virus in the blood. And what they found is that those people with AIDS were 50% less likely to have a high concentration of virus in the blood over that 12-month period. Let's move on to cancer. Here is a study of these, again, young people, nearly 10,000 young people, average age of 23. They were followed up to 6 years, and they looked again at their baseline religious attendance, finding that it predicted a nearly 2/3 reduction in risk of developing cancer. Now, young people don't develop cancer very often, but those who are attending religious services are a whole lot less likely to develop cancer among young people than those who don't attend. Now, there's actually a physiological reason for this that's been discovered. We all inherit a gene that's called the cancer suppressor gene. And that gene, the activity of that gene determines whether or not the body is able to suppress, you know, cancer cells that are coming up spontaneously in all of us all the time. So what they were able to show, they looked at religious attendance and not only religious attendance, but religious involvement in general. And they were able to show, like we showed, that there was a lower there were lower levels of inflammation in the blood of those who are more religious. And again, these are young people. Inflammation was lower, and because inflammation was lower, the activity of the cancer suppressor gene was higher. So therefore, religious involvement increased the activity of the cancer suppressor gene, which would explain why individuals who are more religious experience less cancer. Here's a study of 500,000 Americans, a 15-year study of more than 500,000 Americans, 580,000 US adults aged 30 or over, showing that there is, among those attending religious services once a month or more, well, actually those who are attending less than once a month had about a 10% increased risk of dying from cancer. Now, this is out of the Harvard study that the nurses, so this is 90,000 nurses followed for 14 years, showing that there is cancer mortality is significantly lower among those attending once a week or more than once a week. And that was published in JAMA Internal Medicine. Again, the Harvard School of Public Health. Let's look at cardiovascular disease and stroke. Lower blood pressure in the majority of studies, better cardiovascular functions, and lower heart disease, coronary heart disease, in about 2/3. Here's a study we did in North Carolina among older adults showing that attending religious services at least once a week or more, and praying or reading the Bible at least once a day or more, if you did both of those, your diastolic blood pressure was the lowest among all different groups. And this was after taking into account age, gender, race, smoking, education, physical functioning, and body mass index as well. There's about a 40% reduction in the risk of diastolic hypertension among those who are high attenders and frequent prayer, people who are praying more frequently and reading the scriptures more often. This is out of the Harvard School of Public Health. This is the Nurses' Health Study, published in the American Journal of Epidemiology, the top public health journal in the world, showing that there's about a 10% reduction in risk of developing self-reported hypertension among these 44,000 women without hypertension at baseline during a 12-year prospective study. Again, controlling for over 24 different predictors of hypertension. You know, the science here is just really, really good. This is the Harvard School of Public Health doing this research. They're putting their reputation on the line with this. So they're doing everything possible to eliminate the associations here, the effects statistically, but they just can't. They just can't. They just persist, because I think we're just looking at the tip of the iceberg here. This is looking at death rates from stroke, significantly lower among those attending religious services to any degree. This is looking at Jews in Israel. This is 10,000 Jewish men followed for nearly a quarter of a century, 24 years, showing that those who are most engaged in their synagogue and praying at home and getting involved in the various Jewish religious rituals, that those who are more devout were less likely to die from heart disease, 20% less likely, and that's independent of their blood pressure, diabetes, cholesterol, smoking, weight, and baseline heart disease. Now, this is looking at cardiovascular mortality. This was, again, the Nurses' Health Study, showing a more than 25% reduction in risk from dying from cardiovascular disease among those women attending religious services more than once a week. And it was, about 20% lower among those attending once a week or more. And again, you see this gradient of effect, which is suggestive of a causal relationship. Now, this is after open heart surgery. We're getting a little closer here to Canada in New Hampshire. So this is Dartmouth Medical Center. And we find that the likelihood of dying during the 6 months after open heart surgery is actually 14 times higher, 14, 14 times higher among those with low religious coping and low social support, a lot of which would have come from a faith community. So, you know, the further you get north, perhaps these effects even become stronger. Let's look at overall longevity of all of the studies that we reported in, again, the second edition of the Handbook of Religion and Health. Close to 70% show that religious people just live longer. They just have greater longevity. And that makes perfect sense based on the previous research showing connections with mental health, social health, behavioral health, and physical health. And in fact, that is what is found. Here is all-cause mortality out of the nurses' health study, again, coming out of Harvard. You've got a 1/3 reduction in risk of dying during this, I think, 14-year follow-up period. It was actually 16-year if you're attending religious services more than once a week. And that's, of course, independent of health. Not only does religious attendance facilitate better health, but praying does as well. Here is a study, a 6-year follow-up study of a nationwide sample. I think there were several thousand, and they're looking at the cumulative likelihood of surviving over that 6-year period, showing that those who are daily praying are more likely to survive. This is statistically significant and clinically significant as well. This was actually the University of Miami doing this study. Now, when they looked at AIDS patients and when they followed these AIDS patients over 17 years, these HIV positive patients, they found that actually praying for others had an even greater effect on the longevity of the people who were praying for others. So if you pray for other people, your likelihood of survival is substantially greater, particularly if you've got HIV. Now, not only, you know, is all of that true, but also your cognitive functioning is better as you grow older if you are more religious. Shown in current Alzheimer's research, shows that even among people with Alzheimer's disease, there's actually a 7 times greater likelihood of having a decline in the cognitive functioning among those with low religiosity compared to those with high religiosity. This looks at episodic memory in over 1,000 adults over a 12-year prospective, after 12 years of follow-up. And this is looking at episodic memory. And it shows that praying, like praying to God, enhances episodic memory or reduces the likelihood of, losing your episodic memory. But meditation doesn't help at all. Meditating just by yourself and, looking at your navel and, I don't know, it didn't have any effect in this study. It was only prayer to God that made a difference. Physical functioning is better. This is actually out of Europe. Now, Europe isn't very religious. Europe is a very secular area of the world. And there's 14,000 adults over 50 followed for 10 years. They found there was about a 25% reduction in likelihood of developing impairment in physical functioning among those who were more religious. In other words, those who reported praying, taking part in a religious organization, and being religiously educated. Now, here's a study that created a lot of controversy. This was a very large, very well-done study. This was nearly 10,000 people in both the United States and in England who were followed for these 7 years. And they looked at their risk of developing Parkinson's disease. And among those who said that religion was not important at all in their life, they were nearly 10 times more likely to develop Parkinson's disease. The odds ratio here is 9.99, which means it's this group is 10 times more likely to develop Parkinson's disease compared to those who indicate that religion is very important in their life. So in general, here's a kind of a summary. This is a summary slide of all of the research. And you find a few studies showing a complex relationship. About 250 studies showing that religious people are not as healthy, are sicker than those who are less religious. A few studies showing a trend in that area. A couple hundred studies showing mixed results depending on the particular religious characteristic that's being measured. And then a few show a statistical trend towards better health. And then these are the studies showing a significant relationship with better health. And then several studies show no association. So that's basically what's in the second edition of the Handbook of Religion and Health. So this seeks to explain the connection here. So we believe that faith in God is the source here, which is nourished within a religious community, which is affected by peer influences, by education and training, which is manifested in terms of the theological virtues of faith in God, hope in God, and love of God. This then generates public religious practices, private religious practices, religious commitments, religious experiences, and religious coping. All of this influences decisions that people make in life, lifestyle choices, health behaviors, screening practices, and compliance with treatments. It also influences human virtues. Religion enhances forgiveness, honesty, self-discipline, altruism, generosity, humility, gratitude, patience, dependability. And that influences the experience of positive emotions, enhances social connections, reduces negative emotions, which in turn affects immune, endocrine, and cardiovascular functions, which are all influenced by mental and social health, which then affect physical health and longevity. Bear in mind that all of this is influenced by genetic factors, by developmental experiences, particularly those in childhood, and by personality. This is, again, out of the 2024 Oxford book. Now, in terms of clinical applications, I think we can safely say that mental health providers should take a spiritual history, talk with patients about these issues. Many of the national and international psychiatric associations are now advocating that all psychiatrists take a spiritual history on all patients, because this is part of whole patient care. But the way you do it, of course, has to be in a sensible manner as well. At all times, show respect, value, and support the beliefs and practices of the patient. Patient-centered spiritual history. Identify the spiritual needs that the patient expresses they have, and then ensure that someone meets those needs. Typically, this is going to involve a referral to pastoral care for someone who has been trained on addressing spiritual needs in the setting of either mental health problems or physical health problems. And I have a book here that kind of summarizes all of these clinical applications, spirituality and patient care. Now, this is kind of the big picture model. And I have to say that I developed this model based on some of the work of Oswald Chambers, who was a World War I chaplain. And so basically, you've got your religious community involvement and your private religious activity. And God's part in this is made possible by the atonement. And then our part is having faith in God, belief, trust, hope, love, and surrender to God. And then this leads to that. And what Oswald Chambers says is that God's purpose or aim for human beings is not health and happiness. It's holiness. That's the focus that God has. That's the hope he has for people, that they be holy. And that involves unsullied thinking of the mind, unsullied talking with the tongue, unsullied walking with the feet, developing a habit of moral choices. And even that is, God plays a role in that as well. God's part is involved there as well as there. But then we've got this big part in this, and this is not easy. Now, sometimes, now the health benefits are a natural consequence of the holiness. So it's not that this is the aim here, it's the holiness, but then holiness itself results in better health. And in some respects, John 10:10 also says that. The devil came to kill, steal, and destroy, right? And Jesus said, I have come to bring life and to bring it abundantly, abundant life. That's what's called human flourishing. Human flourishing. Okay. The final word here, particularly in terms of mental health, in the Bible, clouds are always connected with God. Clouds are those sorrows or sufferings or providences within or without our personal lives, which seem to dispute the rule of God. It is by these very clouds that the Spirit of God is teaching us how to walk by faith. If there were no clouds, we should have no faith. The clouds are but the dust of our Father's feet. The clouds, these sufferings, these sorrows, are a sign that He is there. What a revelation it is to know that sorrow and bereavement and suffering are the clouds that come along with God. God cannot come near without clouds. He does not come in clear shining. Now that's something to really think about. Okay, so in conclusion, based on the best available scientific evidence by the best research institutions in the world, published in the best journals, scientific, medical, psychiatry journals in the world, people of faith simply live healthier, happier, and longer lives. I don't know how we have been able to suppress this information from the general public. I don't know how, but it has been. Religious involvement is related to better mental, social, and behavioral health and improves these aspects over time. And all of this makes sense, particularly to those of faith. As religious involvement lessens, the results of increasing secularization, crime rates, alcohol, drug use, and addiction are all increasing. That's been clearly documented by the CDC, Centers for Disease Control, here in the United States. Religious involvement is also related to better physical health, less functional disability, and less cognitive decline with aging. These findings have huge implications for public health and the healthcare costs as religious involvement becomes less common with each younger generation. It certainly has implications for Canada and the United States. But remember that the purpose of faith is not to make us happier or healthier, but to make us holier. So with that, that's kind of the bottom line. Now, here are some further resources. Here's the 3rd edition of the handbook. It's got the latest research in it. My co-authors are both from Harvard. One is an endowed professor at the Harvard School of Public Health and one of the world's top statisticians. He has, Tyler Vanderweel has a PhD in mathematics from Oxford University and PhDs in biostatistics and business from Harvard and University of Pennsylvania. He's a world-renowned researcher. And then John Petit is a psychiatrist at the Harvard Medical School, also well known for his work. And it does cost $200. So it's pretty expensive, but believe me, for over 1,000 pages. And it's got the best studies in the appendix. So you can look at the studies, where they were done. You can see the ones done in Canada. You can see the findings and what was measured and the quality of the study. Each study has one line in the appendix. Now, for $7, you can get this, which summarizes things for the layperson. And my wife and I wrote this, and it talks about faith, talks about a crisis in faith that we're seeing in society, the barriers to faith, how fragile faith is if it's not kept up, that faith is necessary, but it's not sufficient, that there must be love together with faith, and that faith often results from pain. And we describe the steps to finding faith, the steps to maintaining faith, the rewards of faith. Then my wife tells her story, and then I tell my story. And there, it's not pretty, I can tell you. We're very honest in this book. And then we talk about how we're moving forward in faith. So in any case, I think maybe some of you might enjoy this one. We have a free e-newsletter here that you can sign up, get it for free every month. Just go to our website, talks about the latest research. I comment on the latest research, talk about our programs. Here's our website. Lots of free stuff you can get here. Says all of the different programs we're running. We've got religious cognitive behavioral therapy interventions that have been tested in randomized controlled trials, workbooks, all for free. You can download them, even patient workbooks. And then if you want, this Saturday, if you want to know a little, I didn't talk about moral injury. Moral injury is a huge thing now in psychology. Talks about the emotional distress that is the result of moral transgressions. Very, very important topic. If any of you are interested, just send me an email. There's my email. You could sign up. It's 8 hours. 8 hours. There is a cost, though. And then if you want to integrate spirituality into patient care, I really didn't have much time today to talk about that. I'm doing an 8-hour workshop on March 16th. So again, if you're interested, send me an email and I'll send you information. Or go to the website and you can pull up the PDF. Here's the website there. And by the way, I'm happy to send Peter a copy of the PDF so that you can actually print it out of all of these slides that I'm presenting. Now, some of you might want to come to Durham, North Carolina, to Duke, and come to our 5-day workshop, and that's coming up in August. So be aware of that as well. So we have about 2 minutes for discussion, but we could expand that a little bit so that we could have, more time for questions.
Great. Very good. Thank you very much. I don't think I'm muted. Everyone can hear me?
Yes.
Good. Okay. So I'll just open it up for questions. I do have questions if others don't, but I'll just open it up for questions now. And we did set this to be complete at 11 o'clock, but I am certainly welcome the idea of staying on longer, and we'll determine that according to Dr. Koenig's availabilities. So others, anyone have a question that they would like to ask? All right, well, I will start with one if no one else wants to. So a question I have, in all of your studies, can you distinguish between good religion and bad religion?
Okay, very good question. Can we distinguish between good and bad religion? Not much research has been done on bad religion other than what you hear in the media about religion. And a lot of times bad religion is considered to be anything but your religion. So that's not, it's hard to measure bad religion. But there does need to be research on the negative effects that religion can have. But, there's not been any systematic research because it's not very often that religion has these negative effects, except when you hear, a terrorist, flying a plane into the World Trade Center or something, or doing terrorist kinds of activities. Those, if you look at the 8 billion people on Earth, that's done by relatively few people. And the vast majority of those 8 billion who are religious are doing a whole lot of good things as well. And so it hasn't been studied much. But certainly the media tends to overemphasize the bad aspects of religion because the media is more secular in its approach.
Okay. All right. Others have a question that they would like to ask. I'm would be helpful to me. I'll just ask Simon Lasserre. I want to make sure that you can hear me and that if you are able to ask a question, you can ask a question.
Well, thanks, Peter. Hi, Dr. Koenig. I've attended some of your webinars before through the Duke Center, and Gina Adams is a close colleague of mine, so I'm familiar with your work through her and that sort of thing. I'm curious about some of the sociological dimensions of the studies that you were citing, in that often it's easy to set up a polarity between the religious and the secular. And as I read some of the research, a lot of the theorists and sociologists are saying that we are now in a post-secular time where we're seeing a new visibility of religion that is not necessarily tied to institutional religion in the ways that it was in the past. And I'm curious, how does this new situation affect the overall health outcomes that you've been correlating quite strongly with religious involvement? And how does that affect how you measure religiosity or spiritual involvement?
Yeah, so there's a growing number of individuals who would consider themselves spiritual, but not religious. That's, I think, the group that you're referring to, that's growing, that has their kind of their own spirituality, whatever that is. What research has been done comparing, looking at the health of people who consider themselves spiritual but not religious. And actually, what that research has shown, I didn't have any slides on that here, but it's actually shown that those who consider themselves spiritual but not religious, that is a risk factor, that is a flag for worse mental health, greater risk of developing depression, and greater likelihood of substance use, greater anxiety disorders, etc. So the research is, and this research has come out in England. Actually, in England, it shows, and across different parts of Europe and Chile and in the United States, there's clearly this connection. But in England, it's actually those who are spiritual but not religious, they have worse health than those who are neither religious or spiritual. So it seems like the spiritual, those who can consider themselves spiritual but have no connection to any traditional religion, that they are at greater risk. They are not protected. They are not protected like those who are religious.
Is there any insight as to some of the contributing factors to those health outcomes with the self-described spiritual but not religious?
Yeah, I think part of it has to do with people want to feel good about their spirituality, but they don't want to do the work that's required in obedience, in submission, because the obedience and the submission part of religion is what creates the good health effects. Because, I mean, my personal opinion is God created us. He wants us to flourish. And that's why we've got all these laws around here, all these religious do's and don'ts. It's for our benefit. And when you remove those, you're on your own.
Thank you.
Do we have time for a couple more questions or one more question?
Sure, we can do 2 more questions. If there are 2 questions, let's give it a shot.
All right. Anybody else? Two more questions.
I don't have a fully formulated question. I want to say first off, excellent presentation. You covered so much, like really, really good teaching. I really appreciated that. My question is, as I sit in my diocesan office, considering pastoral care in our diocese, the importance of the pastoral care ministry in the parishes, and just, people in the pews don't necessarily want all the statistics. Is there simpler tools or easier pieces of the presentation that can be presented that have already been put together that can be given out? Because I know my people in my pews are not going to listen to a bunch of statistics. I love them, but they're not there.
It's a great question. That little book that me and my wife wrote, that was
Okay.
really focused on just general people. It took the research in the handbook and it includes it in there and makes it more interpretable without all the statistics, and includes the stories that of myself and my wife that kind of illustrate, the search for faith. And I think for the pastoral care ministries within the parishes, I think that the pastoral counselors, those who are doing that ministry, that get that book and read it, and it'll give you some ideas and some fairly simple kind of suggestions on how to integrate this research into the lives of people on the ground. And like I said, I'm happy to send Peter a copy of the PDF of this presentation that you could circulate around as well.
Right. And so just another reminder for anyone who might have come in late, that if you would put your email address in the chat, that will allow me to have a way of contacting you with both this link for this video as well as that PDF. So we have room for one last question and then words of thanks. Anybody else? Going once. Don't be afraid. Going twice. We're done. Dr. Koenig, thank you very much for your presentation today. Encouraging in so many ways. What I appreciated was, although you didn't go into it, that this is also part of your journey, and that in all of the very detailed theoretical work that has been done by yourself and by so many others, but there's also the human part behind it. And as you're sharing what you're sharing, I hear that that longing that we as people, as our communities, are well, that we are holy, yes, but that holiness translates into wellness for everybody, and how important that is, and just the work to help us understand some of the connections around how that is more true, if there is a connection with a religious community and practice and so forth. So just very, very helpful. Really, really appreciate it, and I'm grateful for making us more aware of the work you've been doing. Also, so glad there was a little personal connection with Saskatchewan. So that was a delight. So yes, wonderful.
My dad.
Yes, wonderful. So thank you very much. If you have any questions or concerns or other things and you want to put them in the chat, do so before we close off here. Thank you again. All right. Now, Dave, I'm going to hit stop recording, or